our Facebook Live. This is my effort as your mayor to talk to you every so often, at least 3 times a week, to keep you informed and updated on what's going on in terms of the community's response to COVID-19. Tonight, I have the privilege and pleasure of introducing 4 leading healthcare professionals who are helping to guide us through this unprecedented period of time. And I would like to bring them in right now from our 4 major systems here in Sacramento. I want to welcome Lori Harding, who's the president and the CEO of Mercy Health. Lori, thank you for being with us tonight.
Thank you.
Dr. Stephen Lockhart, the chief medical officer for Sutter Health. Welcome to you, Dr. Lockhart.
Thank you.
Dr. David Lubarsky, who's the CEO of the UC Davis Health System. Welcome to you.
Thank you, Darren.
Lubarsky. And she'll arrive in a moment, having a few technology issues, which is very common here over these last 8 weeks. And that is Sandy Sharon, who's the CEO of the Kaiser Foundation Health Plan. First of all, on behalf of the people of Sacramento, I want to just express our heartfelt thanks and gratitude for what you and all the people who work with you and for you have done over the last 8 weeks. And it shouldn't have taken the COVID crisis for you to get the kind of recognition and adulation that you have received. But I'm glad that our healthcare workforce is being seen as the unsung heroes and heroines of this time. So that's the only way to start here. I want to talk in depth some about how the hospitals and the healthcare systems are responding to the moment. But I want to ask a question that I know is foremost on a lot of people's minds, and it may be foremost on your mind as well, because there's a lot of misconception and misinformation out there. Is it safe for people to come to the hospital? Is it safe for people to go see the doctor? Why don't we start with Lori Harding?
Thank you, Daryl.
Thank you.
What a great question, because I know that's on the top of a lot of people's mind right now as they have gone 8 weeks maybe in postponing their surgical procedures or seeing their physician. And I would say that now more than ever before is actually the safest time to see your physician and to come into your hospital because we've taken all precautions necessary to make sure that we separate the sick patients from the patients that are coming in for well checks and physicals and that sort of thing. In the hospital, same thing. We've separated the COVID patients from the non-COVID patients. So you're not going to be mingling around with that virus in proximity. The important thing is, though, also everybody is accustomed now to washing their hands more frequently than ever before. So I think our practices of infection control are at the top. So yes, it's very safe for you to go visit your physician if you have to, or if it's a preventative appointment, and it's very safe for you to come into our hospitals.
Dr. Lockhart?
Thank you, Mayor Steinberg. I think my answer would be also yes. And in fact, all of our systems are collaborating on a campaign to try to communicate that to the greater community that yes, it is safe. And I want to point out that we have been providing care. It's been different since COVID started, but we have never stopped providing care to our communities. And so we need to remember that. And one of the things that I definitely want people to understand is you should not delay any emergency care that you need because of fear of coming into a hospital. And we've seen some of that where patients have been reluctant, and we see that the numbers of heart attacks and strokes and so forth have been declining. And I don't think that's because they've been declining. I just think that people have been reluctant to come in. So we are the place that you come to when you need help, and we're still here for our communities, and we want you to come. So it is a safe place to be. As Lori mentioned, it's probably the safest place to be.
So Dr. Lubarsky, I'm sure your answer will be the same, but maybe you can add a little bit to it, and then I'll go back to Ms. Harding and Dr. Lockhart. what have been the health impacts of people avoiding going to the doctor or the hospital? For example, have you seen people with chest pains not call and then suffering serious heart attack or stroke? Talk a little bit about that.
Yeah, no, that's exactly what happens, is that when fear dominates the thought process, right? You think that there's, a much greater risk than there really is of coming to the hospital. As a matter of fact, I'm more comfortable coming to work in the hospital than I am going to the grocery store. Mm-hmm. And when you don't come in when you have chest pain and you do show up later with a heart attack, it's much harder to fix. When you have the beginning signs of a stroke and you hesitate in calling for help because you don't really want to go to the emergency room, you end up with a much worse stroke. And what we've seen in our emergency department is people coming in who have worse wheezing from their asthma or more severe heart attacks, those types of things that really are avoidable. And we really have to encourage people to seek the care that they need. I can say two things that I think are important. I have not heard of a single case in our entire health system, and I'm pretty sure it goes in the other health systems as well, where a patient has actually caught COVID-19 in our clinics or in our hospital. We have no recorded case of that whatsoever, and we're testing anybody with symptoms. So I'm pretty confident that that's true. The second thing is that, frankly, Daryl, due to your incredible strong action along with Sac County early on in this crisis, we crushed the curve here. The level of COVID-19 out there in the community or in our health systems are minuscule. We only have 2 patients right now with COVID-19 in our hospital. The other 600 beds are filled with regular people with regular diseases. It is very safe, actually, more safe in Sacramento maybe than anywhere else.
Anything you want to add there, either of you? Lori,
I would add, we've heard stories about moms not taking their children in to be vaccinated. And that is something that I'm very concerned about, because as time goes on, and especially as these children start getting out into public, we don't need that kind of a problem on top of what we've already been dealing with. So we need to be sure that children are getting the right preventative care. Women are getting their mammography done to prevent and hopefully detect things early so that treatment can take care of the patients early. So it's just very key that people not stop with their healthcare needs.
And I would just add, because I think both David and Lori have emphasized that taking care of your health is the best way to prevent poor health or health complications. And one of the ways, in addition to the vaccinations that obviously the children must have, what are we looking for COVID-19? We're searching for a vaccine. So it makes absolutely no sense to not take advantage of those diseases for which we have vaccines. But there's another one that we have a vaccine for, and that's the flu. And I think we want to make sure that we don't forget about the fact that everyone should go at the appropriate time to get flu vaccines, get your flu shot, because that's another thing that often fills up our hospitals during flu season, are people who are sick with the flu, and many of them have not had the flu shot and not taken advantage of that opportunity to keep from being ill. So that is both a help to your own health, but it's also helpful to us to not have the surge of patients with flu illnesses at a time when we may be facing COVID-19 surges.
So let me shift for a moment here to sort of get at the great tension in our society as we sit here together in the middle of May 2020. We all desperately want and frankly need to bring back business, to put people back to work. And as David said a moment ago, Sacramento's done a beautiful job of crushing the curve. And in fact, the surge that you were all well prepared for has not occurred. And yet there is a great fear that if we go back in the wrong way, that we could experience what fortunately we have not. More people sick, more people dying, your hospitals overwhelmed here. Governor Newsom last Thursday put out this criteria for opening restaurants, sort of stage 2.5, if you will. And he said you can't have had a death over the last 2 weeks in the county, which disqualified all urban counties. And when I stepped back and talked to him and thought about it, what he was really saying was, we better move slowly here. In the absence of massive testing, we better move slowly and make sure we do a series of controlled experiments, maybe in the smaller counties, to see if opening up in a broader way leads to a spike in infections. So I know you're not the public health authorities, but you are doctors and nurses here. And I would like to get your opinion on how people like myself, how county supervisors, how others should think about and weigh this balance. Who wants to take that tough one first?
I'll give it a try, because actually
Okay.
I'm not a public health official, but my PhD is I'm a biostatistician and epidemiologist, so I have some experience with at least thinking about these issues. And I think it's a false choice to think that you either can have health or you can have economy. You can have both. Obviously, the health of people in our communities is of paramount importance. That is number one. So you have to do things safely. But I do think there is a way to open cautiously, deliberately, and in a phased approach. And I think, as you've mentioned, that's what Governor Newsom really is about. And I applaud him for this thoughtful efforts to say, look, what we want to do is we want to open up, we want to measure, evaluate. It's a very scientific approach. Measure and evaluate impact of a policy change. And if it's okay, maybe we can go a little further. If it's not, we might have to retract. And the other thing I'd like to point out is that, we need to realize that when we're talking about the possibility of missteps or the consequences of missteps in this arena, it's measured in human life. And that's a measurement that is quite grave. And also we've seen, as COVID-19 has ripped the Band-Aid off of the structural inequities, both in our society and our healthcare system, that burden has been borne disproportionately by communities of color, particularly African-American communities largely, and in some instances our Latino or members of our Latinx communities. So we need to be aware of that as we open up and think, well, we may lose lives, and what lives are going to be lost because there are moral and ethical consequences around, are we saying that we value some life more than others, that we're willing to risk certain lives more than others? I don't think that's what the people of California are about. And I'm very proud of that fact. I hope that that's true nationwide, but I can guarantee that's true in California. So I think we just need to be very, very thoughtful and very cautious. But I think there is a way to do it. And I will say, I think that Governor Newsom is doing a really good job of moving forward in that way.
I agree with you completely about the governor in the most difficult of circumstances and situations. But maybe I can put the question another way and put this to Lori Harding, which is, when inevitably the stay-at-home orders are relaxed even more, and let's just take restaurants for as one example. What is your biggest concern from a systems and a healthcare perspective?
Well, my biggest concern would be another surge, right? We don't want to do that again. We want to do everything possible to prevent the number of casualties that we had. Even though for Sacramento, low compared to the rest of the nation, but we still, every one counts. But what we do need, and I like what Dr. Lockhart said, the balance is what's key here. The economic impacts could be as devastating as some of the physical impacts of the COVID-19 disease if we don't slowly start getting our economy back into an open state. So we have to be careful there, because people are already, out of jobs, almost 20% unemployment rate, expected to even go higher than that. And as you hear more and more of these people that are just stressed to the max because they just don't have the income coming in, their spouse lost their job, you're having more mental health issues. It's just devastating to our population to not have the economy open. So let's do it smart. Let's make sure that when we open the restaurants, we do have distances between all the patrons that are in the restaurant. That does mean less customers at any one time. So that's going to be tough for the restaurants. We need to have the precautions of the masking for a while. So social distancing, masking, hand washing, all of those, I think, are a way of our new norm, as you've heard people talk about it. So we've got to change the way that we've behaved in the past and be more aware until we have a vaccine that we know is proved to work. We have to be very careful, and maybe even beyond that, if new viruses start coming into our society.
I again agree absolutely that we need to take every precaution. But David Lubarsky, even in taking those precautions that Lori mentioned a moment ago, in the absence of a vaccine, in the absence of a massive amount of testing nationally, and antiviral testing, isn't everything we're doing exposing ourselves to the real potential of that spike that we all want to avoid?
Yes and no. Again, I'm going to go back to the idea that this is really not run rampant at all through our community. So the level that exists is quite low. If you look at the new, I'm going to put a little nuance to this whole idea of what we should be following and the testing. I think deaths are a really bad metric because they lag by 3 weeks, really, usually when a case begins to present. So if you're judging by that, you're kind of 3 weeks late in what you're doing. If you're looking at the number of cases, given the more expanded testing that we're doing, you're also not really, that's variable based on how many tests you do, how many cases you find. What we really need to follow is how many hospital admissions there are and new hospital admissions. And that, by the way, is what Governor Cuomo now is finally presenting correctly on CNN, because that really is the thing that tells you in the current state, are we doing well or not doing well? I will just say at UC Davis Health, I think we've had one admission this whole week. We may have a death down the line. We have a very elderly person potentially in an ICU who may not survive. That person could have been there a month. So understanding that is really critical. And so I hope that the governor will change that criteria. And then also we need to segregate mobile versus non-mobile, because again, we're working with Sac County, I think, as you know, Daryl, to go out and test whole nursing homes and really get it. So we get an entire, those people are going to have a high consequence of being tested and a high case rate, but they're not the ones, and they are not going to be out in the restaurants. So we have to also segregate how we're thinking about this into the mobile and the non-mobile population and deal with them differently. And I think that what you'll find and what has been true is that many of the deaths and many of the current cases are being diagnosed in nursing homes currently. And we need to segregate that from the rest of the community, because if the rest of the community has minimal cases, then the risks of reopening are actually much lower than we're estimating.
And are you confident that when we do that disaggregation, if you will, in Sacramento, that are you relatively confident that we would not have a spike among the remainder of the population?
No, I would be foolish to be confident about that. But I think that given the much better availability of testing here than in many other places, given the fact that we have a low prevalence in our community of the disease, that should the disease occur, we now should have the ability to go back to containment, contact tracing, and we really do need, if we're going to do this, develop a quarantining plan. Sending people back home where they can share the disease with their family members once we diagnose them is frankly never been a good idea. And we need to come up with a slightly different approach this time around. And then I don't think we'll see a surge. I'm hopeful that we will not see a surge, but can't guarantee it, of course.
Well, of course, there's no guarantee. And Lori and Stephen, you want to add to any of that by doing the kind of aggregation, if you will, that David just talked about? Do we have a better chance then of minimizing the risk of a spike or a spread if we reopen?
Well, I think as David mentioned, so if you look at the Northern California, Southern California discrepancies, if you look, so Sutter Health, we're all in 22 counties in Northern California, and I know actually our friends from Kaiser are in both north and south, and Lori, I think you're
too, yeah.
Yeah. So if you look in the Northern California segment, the rates are low and they're very stable. They're not even really increasing. They've kind of very much flattened out. They're not quite all the way down yet, but they're flattened out to sort of a very low level, whereas you've seen spikes in Los Angeles County. So for example, last weekend I was speaking about Ventura County wanting to open beaches, whereas Los Angeles County was busy spiking with cases with right next door. And of course we have to remember those lines on the maps are not barriers. They're just actual suggestions for how to get to the beaches, just to cross that line and go over to get to the beaches. So we have to understand that no, there aren't real physical barriers there, but certainly there has been a north-south sort of dichotomy. And what that's meant for us in the northern part of the state is that we've had, I think, very stable ability to predict and model what we can anticipate our behavior, which is one of the best benefits, most outstanding benefits that we have, is the fact that our models can actually be relied upon. And I would agree with David that, our reopening, if we do it thoughtfully and carefully, should be opening a sliver of a door to something that hopefully the beast is not, waiting behind the door. But if there is any spikes, we can, I think, very rapidly shut down on it.
Are we ready to move a little faster now?
Well, I know for Dignity Health, we started our elective surgeries, but we're starting slowly and we're watching, and then we're going to grow over the next week. Right now, we're about 30% of our baseline. Next week, we'll be at 50%. We'll continue to monitor. At all times, we have to be able to retract back, right? We know if we start seeing a spike again, South Korea is a great example, right? They opened up, they started having parties, going to the bars, and boom, now they've got a big spike again. So we have to be smart, and we have to be careful, and we have to be flexible. But we are ramping up. We have to. I need to get my nurses back to work. I want to get all the employees back to work.
But we know how to prevent the transmission of the flu. This is not really that much different. You stay away from people coughing and sneezing. You practice hand hygiene. You in this case, you're wearing a mask because we're not sure, right? You may be shedding some virus before you're symptomatic. So if everybody just did that, if everybody would just play ball with the rules that we know are fairly fine, we would probably open up a little faster.
So on that score, your provocative mayor suggested on this broadcast a week or so ago that as we do begin to come back, that the mask issue ought to be a requirement, especially in settings where you're around other people. Now, you could disagree with me publicly if you would like here. What's your point of view on my provocation?
Well, while I would love to disagree with you publicly, I won't, because I think you're right. The other thing I will note, though, and I see this as I walk around my community and I've sort of noticed it, is that wearing of a mask is not a substitute for physical distancing.
We know that. 6
feet is an important component of these social interventions. And I've seen people put on masks and then sort of act as if that gives them immunity. It does not. So I think that's a very important concept as well, to just reinforce with the public so everybody knows. And as Lori says, if we do these things, we physical distance, we wear the mask, we wash our hands when we, after everything we do pretty much, I think we should be in pretty good shape.
And I think the masking is really critical. But if I just touch for 1 second on gloves, because I think there's a lot of misinformation. Gloves they're not really good, because, you touch your nose, your mouth with your glove and then touch the doorknob. It's the same thing as if you did it with your bare hand. And so the gloves are really not, I know there's the idea out there that the servers should all wear gloves, unless they're changing their glove in between each and every table they serve, and they're discarding gloves anytime they touch their nose or their mouth. And it's just like your hands. You're just, honestly. So I'm a little concerned that there's an idea that somehow gloves are going to be protective. They're really not.
And David, if I can interject really quickly, I will go one step further and say I think it's worse than nothing.
Yeah.
Because I have observed, and we're both OR people, anesthesiologists, so we're, this whole protective gear and gowning and gloving is our life for the last 30, 40 years. And so we very carefully watch each other when we do it, because that's part of our job. And I see my neighbors and friends, they wear these gloves. I tell them, take them off, because they touch things and then they think that because they're wearing a glove, that somehow when they take that same glove and then touch something else, that it's sterile, and it's not clean, it's not sterile, you just transferred the dirt from, one place to the other. So if you have your gloves off, just wash your hands and you're good.
Masks, yes. Gloves, not so much.
Not for the general public, I think.
Not for the general public.
We're talking for personal protective equipment in a hospital. That's different.
And the other conclusion that I draw as we shift to a couple of other topics is that when we do get the green light from the governor, we do this right, we can really begin a progression of opening up more than not. And I think that's very encouraging, should be very encouraging to the people. That's good. So let me shift for a moment. The healthcare workforce, as we talked about at the very top of the broadcast here, has achieved a deserved heroic status. I mean, it's really wonderful to watch nationally, here locally. I was at an event where the firefighters all took the time, and the police officers, to applaud the healthcare workers at Sutter in this instance, who were coming on to shift and leaving shifts, and it was just sent real chills. Has any of that surprised you in any way? You've been in the healthcare field for a long time. What has that meant to you, and has it surprised you?
Hasn't surprised me. I think it's an acknowledgement of what the healthcare workers do every day. I mean, as a nurse, I was trained to take care of patients who had an infectious disease. But I can say, as an active hands-on nurse, I never worked during a pandemic. And knowing that you are working and saving lives, but then also going home to your family, and there's a lot of unknowns, that's very frightening. And to see the courage of these healthcare workers that come in every single day, regardless, because they know that's their calling, that's what they came into healthcare to do. I just applaud the staff, and I'm not just talking nurses, I'm talking everybody that touches that patient, the respiratory therapists, our physicians, everyone. It's just remarkable, and they deserve every accolade that they are getting right now.
Yeah, I would agree. I just want to chime in and say that I'm not surprised, because I've spent the last 40 years, maybe I shouldn't say it's been that long, but working with incredible people. And that's really what we're talking about here, is a bunch of incredible people. And as Lori mentioned, it's the clinicians, it's the doctors and the nurses, but it's also the environmental service workers who come in and manage, clean those rooms and help with the patients, and folks who are dealing with families, and just the whole group. And as Lori mentions also, we can't forget that these are people who are also dealing with all the same things we are. They've got kids at home they're trying to homeschool, but that school doesn't have the online teaching done right yet, and they're all cooped up, and the husband's lost the job, and what are we going to do with all these things that all of us are dealing with. And yet they get up and go every day and literally put their lives on the line, and then worry about whether they are going to harm their families in some way because of the heroic actions they have taken. So to me, it's just a testament to the beauty of the human spirit when we have ourselves focused on all the right things and caring about and caring for each other. We can do miraculous things.
The only thing I'm going to add is to say that our society for too long has been talking about the cost of healthcare and forgetting about the heart of healthcare. And what you've seen during this crisis is the heart of healthcare. That is what we do, why we do it, and that's our life, and we're committed to it. And it's nice to see everybody recognize that the doctors and the nurses and the respiratory therapists and the environmental service people in the hospital every day giving their all to take care of someone else. That's what's really important.
Yeah.
The healing professions. Yeah. Thank you. I want to shift to mental health. We have a few more minutes. I want to talk about mental health. I wrote an op-ed piece in the LA Times today that got published that basically said it's time to democratize our mental health provider movement, that we need to train many more people to be caring more than anything else for people who are lonely, who are depressed. And of course, people need the professional help as well. I want to know what you've seen around mental health during this pandemic and whether or not this has given you any new insights into how we might fix what most people consider to be a broken mental health system in our country. Who wants to try that one? David, you go first.
Oh, that is a tough one. But you know what? We actually have the ability to do this. We actually have the funding to do this. Because when we don't spend it on mental health, we're already spending it in so many other ways for disease processes and broken lives that require other social resources. And if we could just put together all the things that we currently have, but do it in a much more rigorous and systematic way, I think we could really make an impact on the mental health crisis. Because what it does is it spills out into our emergency departments, it spills out into emergency authorizations to retain people. It eats up services around EMS and other first responders. And we just put this all together and redirected those resources to truly take care of those with mental illness. Probably wouldn't cost society any more money, but it would be so much better. More
humane. Lori?
Yeah, Daryl, I feel as strongly as you do about this. I think that the problem in our society is that mental health, for whatever reason in the past, has always been separated from physical health. And mental health is a disease, just like diabetes and just like any other disease that someone should have. So why financially is it in a separate bucket that people don't have as access to? And so somehow, politically, we've got to get that together so that they're not going through separate ways to be covered for mental health. As if it becomes part of their healthcare plan automatically, it would, I think, help to get more prevention taken care of. But, you know, mental health, I believe strongly, like David said already, it's at the root of many of our homeless issues that we have. If we can get people the medications they need for their disease, they can hold a job down and they won't be stranded on the streets like they are today. So I believe strongly we've got to do something better.
Yeah, and I would just briefly add that it's my sincerest hope that COVID-19, the pandemic, as horrific as it is and as disruptive as it's been to our lives and our civilization around the world, that there will be some things that we will learn and take away from it. And one of those, I hope, will be the importance of mental health. It's something that has been too long neglected. And as David has mentioned, we know its importance. We know what we need to do. Do we have the courage to do it? And just like we know that how the public is going to deal with COVID-19 as we begin to reopen and change, and there's going to be a new normal, new way of doing things. Within the healthcare system, I think we will find that we will not go back to doing things the old way either. So it's my hope that as we learn about mental health, we learn about how to scale with our video visits and reach thousands of people instead of tens of people. You know, how can we use some of those models and learnings that we've had to translate into how we address mental health, at least to introduce people to the system, at least to help them self-identify and give them access to a process for health. So often we've said, well, you know, we don't have a place to send them. We don't have somebody to refer them to. There aren't enough providers. Well, somehow we managed to scale up big time for COVID-19. How can we create a similar model for mental health? And how can we raise the profile of mental health to the point where we recognize that, you know, managing that both in a preventive as well as in a treatment modality are going to be something that's going to be really critical for our future public health, which is another area that I think the pandemic has shown us is the infrastructure in public health.
Oh my.
Hopefully inadequate.
I don't think we'll ever ignore public health again.
Right.
I really hope not.
I want to end this with two big picture questions here around the future of healthcare. And so for people out there, we can keep it at 30,000 feet. What percentage of healthcare visits currently are done through telemedicine or telehealth? And as a result of this pandemic, a year from now, 5 years from now, what will be the percentage of medical visits that will be done telephonically or by live stream or Zoom or some other way to connect remotely? Give us a big picture there.
I'll start. Within the Medical Foundation here in Sacramento, I've been trying to push for virtual visits for forever. And we were so proud a year ago when we hit the 100 mark. We had 100 virtual visits and we were just so excited. And as a system, we said, let's really put a big goal out there and try and do 1,500 in a year. And everybody said, oh, there's no way. And we didn't make it. We didn't make it. COVID hits. We've done 15,000 virtual visits in just the 2 months that we've been going through this this pandemic. So it tells you a couple of things. One, why is it all of a sudden the government knew where the barriers were? Why all of a sudden they say, well, they'll pay for a visit virtually, just like they pay for a patient to come into the office, right? So now the physicians are paid to see the patients virtually, which incentivizes people to figure it out and make it work, right? So it's, I think, a huge learning that has been for me is to watch how the government worked during this pandemic and how they knew where the barriers were. And I'm talking CMS, the federal government. They knew where the barriers were that were blocking ways of getting care done more consumer-centric than before. They were able to drop all of those barriers and make it easier, and voila, it works.
It works. Are we going back? I
don't think we can never go back the way it was. Absolutely not. People like
Stephen and David. Are we going back from this surge in a good way of televisits?
Stephen?
Well, I would say no. Just as Lori's experience, we have one of our physicians who's an amazing fellow named Dr. Albert Chan, who had put in all the infrastructure for video visits, been working on it for years. And we were doing 20 to 30 a day. We're hit over 7,000 in a day, which, as Lori said, just shows that we could do it. We just had to get the locks unlocked and off we went. But the other point, again, that was mentioned is that patients love it. And so there's no way they're going to let us go back, number one. And the second thing is, with the video visits, there is something to being in person as well. We all get that. But there's also a way in which video visits gives other insights. For example, even in this broadcast this evening, I can get a sense of each of you as people because you're at home, and I see David, where David is probably his house, and painting on the walls, maybe from his kids. So, I can get all of this information that you wouldn't normally get. And people spend 99% of their time not in a hospital, not in a clinic. And we have very little insight into things that drive our patients' health when they're not with us. And video visits actually is a way that we can gain a little bit more insight into that. So I think it's been a really great boon. And I see no chance of it going back to what we had before.
David, briefly?
Yeah, same thing. When I first got to UC Davis 2 years ago, I set an ambitious goal of 1% of all of our visits. It would have been 10,000, right? Because we see 1 million people a year. And literally overnight, in 3 weeks, we went from under 1% of our visits being done with virtual visits, despite prodding, to 50% in 3 weeks. And it's just because when it's in everybody's best interest to do it, and it is in everybody's best interest to do it, to make it easier on mom, and they don't have to drag their kid in necessarily, right? It's easier to if you're lucky enough to have a job, it's easier to actually not have to take off a whole day from work to see the doctor and go to the office. You just get on your computer for half an hour. It just makes so much sense. And I guarantee you, we're not going back.
We're not going back. Last question. So tomorrow, the City Council is going to have a workshop where we begin to discuss the federal stimulus dollars that the city has received, $89 million. I have suggested that we set aside $20 million for workforce development and worker retraining. And so for people out there who may be in a different industry, who have either lost jobs or are worried about the future of that industry, what would you say to someone who wants to get a career, have a career in the healthcare field, whether it be allied health, whether they want to go on through their education to get higher degrees? What about the future of the healthcare field? And what should anybody do who wants to get started? Lori.
Okay, I was waiting to see who's
Sorry. Yeah.
Well, obviously, healthcare is a wonderful field. I always talk to people and try to mentor people to go into healthcare. It's there's so much variety, and depending on what your interest is. But I would have to go back to the last subject, digital. And I think the world of digital is definitely something that's expanding in all of healthcare. And so I would encourage the young folks out there to, get some education and training around that, because I think as we move forward in more of these virtual visits and that sort of thing, people are going to need that expertise. But all fields of healthcare, we're the average age of a nurse, I'm not even going to say I'm beyond the average now. So it's getting closer and closer to retirement. So we have a huge number that need to come through that pipeline to take care of the population. So healthcare is a wonderful field for everyone.
Stephen?
I would agree. I mean, it's a noble field. It's one that certainly has made and given meaning to my life over the last 40 years. And I would also say that, we're learning how to provide care differently. This pandemic certainly has been a very clear example of how we need to change some things. One of them is just learning how that we can work in teams of people with a variety of skills. I think we've also shown that the ability to have culturally competent care is hugely important to determining whether people access care and how they access care. So we're fortunate to be in an environment and a state and a part of the state which is hugely diverse. So I would say for those people who bring diversity into the workplace, they ought to think about healthcare as a place where they can contribute. And even if you are not thinking of being a doctor or a nurse or some other technical medical part of the profession, there are so many different pieces to this puzzle that will need filling, as Lori said, that I would encourage everyone to at least look into it, and we'll welcome you with open arms. Yeah.
Good. So David, take us out with this variant of the question here, which is that the city is working very collaboratively with all the health systems, specifically on this project at the Med Center, around the Med Center called UC Davis. And our goal as a city is to connect as many young people from our neighborhoods, especially our disadvantaged neighborhoods, to educate and train so they are ready for those new jobs in the life sciences and the technology field around this initiative called Aggie Square. How would we get started together there?
Right, I think that's a great way to end, because it's the end of the beginning, if you will, as we begin to think about putting up our first buildings. The brainchild of Gary May, just really a brilliant foresight into what this city needed, which is this public-private or public-public partnership, if you will, bringing in also private commercial interests. Because when you have that aggregation of life sciences and other educational opportunities in one place, it is an anchor for the surrounding area, which definitely is underserved in general. And we have an amazing opportunity to create job training programs and to get people into both the healthcare and life sciences and educational fields that will be available in Aggie Square. And this is so critical because, as we all know, the trajectory of health is first and foremost dependent on the trajectory of education and work in those communities. And so they all three go hand in hand. And so as we expand, and every company that's going to come in is going to help us expand our mentorship in STEM in that community. And we provide job opportunities, and people have a more in their livelihood to share with their children. Then the health of the community will improve at the same time. It's all good. And thank you for helping making that possible, Daryl.
Thank you. Thank you. Hey, I want to thank all of you. And I want to say to Sandy Sharon, who had technology difficulties, don't worry about it. We missed you, but we'll get you on this highly rated program sometime in the near future. But a big thank you to David Dubarski, to Stephen Lockhart, to Lori Harding for coming on tonight, and for all your organizations and you are doing to keep Sacramento safe and prepare for the future. I think it was really informative tonight. Thank you very much.
Thank you.
Daryl.
Good night.
Good night.
Night.